Hello friends, I'm Dr. Chatterjee and I wish Happy Doctor's Day to all my teachers, seniors, juniors and colleagues. Beside the fact that today is Doctor's Day, this day is very special to this channel as this marks the 3 years in YouTube. Though I have not been able to remain so much active due to lack of time, but I'm trying again to continue this journey, bring to all of you something different. To all my patients, some facts and points they should know if they have disease, and to my juniors, I'm trying to give out as much as I have learned over the years. So let's begin for today. Today, we are going to talk about lumbar spondylosis. What is lumbar spondylosis? Lumbar spondylosis, also known as degenerative disc disease or osteoarthritis of the spine. It is the condition that affects the lower part of the spine, particularly the lumbar region. It involves the degeneration of intervertebral disc, facet and joint and other structures of the lumbar spine. So, in order to learn what is spondylosis and to know about it, we should also know what are the different types of spondylotic changes which happens over the time being. The changes that affect various structures leads to different types of lumbar spondylosis based on the underlying pathology. Here are some common types. Number 1 is disc degeneration. This type of lumbar spondylosis involves the degeneration of intervertebral disc, which is soft and cushion-like structures. This degeneration can lead to loss of disc height, decreased elasticity, and the formation of disc bulges or herniation, which is the main cause of pain. The second type of pathology we see is facet joint arthritis. Lumbar spondylosis can also result from degenerative changes in the facet joints, which are small joints that connect the vertebrae. Facet joint arthritis or facet arthropathy can cause inflammation, joint space narrowing, bony spurs or osteophytes, and stiffness in the affected joint. The third type of lumbar spondylosis we know is ligamentum flavum hypertrophy. The ligamentum flavum is a ligament that runs along the back of the vertebral canal, providing stability to the spine. In lumbar spondylosis, the ligamentum flavum can thicken and become hypertrophic, narrowing the spinal canal and compressing the spinal nerves. Number 4, and very important one, is foraminal stenosis. Lumbar spondylosis can lead to foraminal stenosis, which is the narrowing of the neural foramina and are small openings between the vertebrae through which the spinal nerves exit the spinal cord. Narrowing of these openings can result in nerve compression and cause symptoms such as pain, numbness or weakness of the legs. The number 5th one we know in lumbar spondylosis is spondylolisthesis. While spondylolisthesis is a separate condition, it is also considered to be a type of lumbar spondylosis as it involves the forward displacement of one vertebra over the one below it. This displacement can occur due to degenerative changes in the intervertebral disc, facet joints or other spinal structures. After this, we need to understand what are the causes of this lumbar spondylosis. So, number 1, generally all types of arthritic changes are generally or degenerative changes are associated with age. So, age is the number 1 factor. Lumbar spondylosis is commonly seen in older adults as the wear and tear of the spine over the time can lead to degeneration. Number 2 is repetitive stress. Activities or occupations that involve repetitive movements, heavy lifting or excessive strain of the back contribute to lumbar spondylosis. Number 3 is sedentary lifestyle. Lack of regular exercise or physical activity can weaken the muscle of the back, which are supporting the spine, making it more prone to degeneration. Number 4 is obesity. Obesity being another very big factor in lumbar spondylosis. Being overweight puts extra stress on the spine, increasing the risk of spondylosis. Number 5th is genetics. Certain genetic factors can make some individuals more susceptible to spinal degenerations. After this, we need to know what are the management we can do. So, what are the management? Number 1 is physical therapy. Specific exercises and stretches can improve strength, flexibility and posture reducing symptoms and prevent further degeneration. Number 2 is heat or cold therapy. Applying heat or cold packs to the affected areas can provide temporary relief from pain and stiffness. Number 3, lifestyle modifications. Definitely with all the physical activities and heat and cold therapy, lifestyle modification is needed. Maintaining a healthy weight, practicing good posture and avoiding activities that strain the back can help manage the symptoms. Number 4 is assistive devices. For those who are having lumbar spondylosis, in some cases, using braces or lumbar supports can provide additional support to the spine and alleviate the discomfort. Now, after this, we should know about exercises or some yoga poses that are beneficial for individuals with lumbar spondylosis. First, we will talk about the exercises. So, in exercises, the number one exercise which we can think of is cat-camel stretch. Start your hands and knees with your back straight, arch your back upwards like a stretching cat and hold it for a few seconds. Then release and let your back sag downwards like a camel. Repeat this stretch several times. Number 2, pelvic tilt. Lie on the back with your knees bent and feet flat on the floor. Gently flatten your lower back against the floor by tightening your abdominal muscles. Hold for a few seconds and then release. Repeat several times. Number 3 is bridging. Lie on your back with knees bent and feet flat on the floor. Slowly lift your hips off the ground, keeping your back and shoulders on the floor, holding for a few seconds and then lower your hips back down. Repeat this exercise several times. Number 4, knee to chest stretch. Lie on your back with your knees bent and feet flat on the floor, slowly bringing one knee towards your chest, using your hands to gently pull it closer. Hold it for 15 to 30 seconds and then switch the legs. Repeat a few times for each side. Now, coming to the yoga poses which we can do for lumbar spondylosis. Number 1 is the child's pose or balasana. Kneel on the floor, then sit back on your heels and bend forward, extending your arms in front of you. Rest your forehead on the floor or on a cushion. Hold the pose for several deep breaths. Number 2 is cat-cow pose or Marjaryasana or Brithilasana. Start on your hands and knees. Inhale, arch your back and lift your chest and tailbone, cow pose. Exhale, round the back, tuck your chin to your chest and draw the navel towards your spine. That's a cat pose. Repeat several sequence for several times. Downward facing dog or Adho Mukha Savasana. Begin on your hands and knees, then lift your knees off the floor, straighten your legs, lift your hips towards the ceiling, keep your back straight and your heels reaching towards the ground. Hold for several breaths. Number 4 is Sphinx pose. Lie on your stomach with your legs extended behind you. Place your forearms on the ground, elbows aligned with your shoulders. Press through the forearms, lift your chest off the ground. Keep your lower body relaxed. Hold the pose for several breaths. Now, while doing all these exercises, always remember to listen to your body and only do exercises or poses that are comfortable and do not exacerbate your symptoms. It is always a good idea to consult with a healthcare professional or a certified yoga instructor or a physiotherapist who can provide guidance and adapt the exercises to your specific needs. Now, coming on, how can we prevent this lumbar spondylosis in our patients? For this, if you can follow this certain rules, you will be benefited. Number 1 is regular exercise. Engaging in regular physical activity, including exercises that strengthen the core and back muscles, can help maintain spinal health. Number 2 is proper lifting techniques. This is one of the major causes of lumbar spondylosis, is improper lifting. When lifting heavy objects, it is important to use the legs and not the back to avoid twisting motions. Number 3 is maintaining a healthy weight. Excess weight puts added stress on the spine, so maintaining a healthy weight can reduce the risk of developing lumbar spondylosis. Number 4, ergonomic adjustments, that is making adjustments in your workplace, such as an ergonomic chair or adjusting the desk height can maintain a proper posture and reduce stress on the spine. Number 5 is avoiding prolonged sitting or standing. This is very important in case of lumbar spondylosis. Taking breaks to stretch or change positions can prevent excessive strain on your lumbar spine. Knowledge. Now, why we are talking about this? Knowledge about lumbar spondylosis, its causes and management and prevention is valuable to common people. It helps individuals recognize symptoms, seek timely medical advice and engage in self-care. Understanding exercises, stretches and yoga poses can provide relief, improve flexibility and strengthen supporting muscles. Awareness of preventive measures allows or lifestyle modifications promoting spinal health and reducing the risk of other spinal conditions. Informed decision making, ergonomics and posture can prevent symptoms from increasing. Overall, this knowledge empowers individuals to take control of their spinal health, manage symptoms effectively, and make informed choices of their well-being. So let's start about the homeopathic management part. So this part is for the students. Before starting with homeopathic medicines, we must all remember that constitutional treatment is the best treatment. Some medicines we can think of are rust-ups, history of sprain, pain and stiffness of lumbosacral region, better motion, lying on something hard, rubbing, warm application, worse during rest and rainy weather. Though almost many symptoms of lumbar spondylosis is covered by this drug, but it gives only relief for a short span of time. The second medicine we can think of is ruta graveolens. Backache better by lying on back, better by lying on hard surface, aggravation from sitting or walking after sitting, injury to the back can be used as a primary medicine to start treatment of symptoms correlate, if symptoms correlate. Third medicine we can think of is belly spur. Best useful in ankylosing spondylosis, railway spine, history of sprain or injury to the back is the best remedy for old laborers and gardeners, which means best for people who are carrying a lot of weight or those who are working mostly in bad posture. Fourth medicine we can think of is simicifuga. Simicifuga has a wide use as in any kind of muscular rheumatism. We have also seen a great use of cervical spondylosis as well. Pain are cramping in nature, neurological origin, that is pain is due to nerve compressions. Spine is very sensitive for pains in the lumbar region and sacral region. Pain radiates to the thigh. This is one very important symptom of simicifuga. Number 5 medicine is nux vomica. Very common medicines, less used though in backache. 3 main symptoms to focus on is first back pain with unsatisfactory stool or retention of urine. Second, back pain worse touch and must sit up in bed to turn in bed, also aggravated by sitting. Third, patient may be chilly or hot or ambithermal, but they desire covering while sleeping. This is very important for nux vomica. More characteristic symptoms include irritability and fault-finding character, gastric symptoms predominant like nausea without vomiting, colic, constipation with frequent ineffectual urging. The next medicine, 6th medicine we can think of is calicarb. Calicarb has a tubercular diathesis, great exhaustion of the back, stiffness and paralytic feeling in the back. Back pain extending up and down, extending to thighs, more suited to females, back pain aggravated during the menses and after miscarriage. History of injury may be present. Gastric symptoms like carbo-wedge, dyspepsia with sour eructations, constant feeling as if stomach was full of water, often used after carbo-wedge. Number 7th medicine we can think of is asculus hip. Very frequently used in backache, lameness in the back and legs, back and legs give out, worse walking or stooping, lumbar spondylosis along with piles and constipation, we can think of asculus hip. Number 8 medicine we can think is very important one, plumbum metallicum. Sclerosis of the spinal cord, lightning like pain better by pressure and rubbing, paralysis of lower extremities with definitely obstinate constipation, neuralgic pain in the rectum. Another salt of plumbum we can think here is plumbum iodum. All are symptoms of plumbum metallicum plus increased hunger of iodum group, all symptoms of back pain along with ataxia is very important for plumbum iodum. The 10th medicine is very important one again, staphysagria. Back pain with history of anesthesia, pain in the small of back, pains as if broken in loins or sensation of overlifting or straining the back. Pain in loins aggravated rising up. Main point of staphysagria is stiffness of the muscles. In order to prescribe staphysagria, a mental picture should be speculated, that is either explosive anger, that is throws things in anger, or escapism, both indicating a suppressed insult or form of a blow to self-respect. Often after staphysagria, causticum is indicated, which is against has similar stiffness of the back pain aggravated from rising from sitting, who is chilly patient and better in rainy weather, like carcinosin. Very sympathetic, often those patients who may give up their spot on the line if they see someone suffering. They are also pet lovers like carcinosin. 11th medicine we can think of is macrodin. Now, the tincture of this medicine is prepared from the alkaloid of the plant resinoid of Simicifuga racemosa. So its chief sphere of action is on muscular rheumatism again. Main symptom is muscular weakness, better by moving about in spite of weakness. Pains as if muscles are bruised. Prominently, a female remedy, excellent for dysmenorrhea in 3x power potency. Back pains are better during the flow. The 12th medicine we can think of in this order is Calcarea florica. Pain in the back and from strains and after riding vehicles, that is after jarring, tired aching from traveling with restlessness. Principally used for bony growths and bony ulcers, mostly given as painkillers in treatment of lumbar spondylosis, where osteophytes are prominent. It is generally given in 6x potency. 13 medicines which we can give constitutionally here is sulfur. Sulfur should not be thought of in treating lumbar spondylosis and should always be used as a constitutional medicine. If sulfur is indicated, back pains of sulfur are worse when standing, just like valeriana. Number 14 medicine is thuja. Though we should not have any favoritism in medicines, but when it comes to back pain, thuja is definitely my favorite one. Thuja is a very undermined in back pain in spite of having so many symptoms. Pains from the middle of lower back with tenderness of muscles on each side, drawing in sacrum, coccyx and thighs while sitting. After long sitting prevents standing erectly. Pain as of a fracture and stiffness in the loins, back and nape of the neck, especially in the morning after rising. Weakness from injury due to lower back, drawing in and back and loins when seated. Boring pain in the back, pulsation in the spine, violent stitch between coccyx and anus in 7 p.m. when walking, and with this definitely other generalities of thuja must be present in order to prescribe thuja. Number 15 medicine is again a favorite medicine for most practitioners is hypericum. Consequence of spinal concussion, violent pains and inability to wall or stoop after a fall on the coccyx. Aching pain and sensation of lameness in the small of the back, stitches in the small of the back, pain go from down to upwards. The last medicine in this list would be medorinum. Now, medorinum in back pain, whenever it is indicated, it is given as a constitutional medicine. It should be given very carefully in a moderate power and only few repetitions. At first, in many cases, it tends to increase the pain and can be given as an intercurrent. Pains are intolerable and are of neurological origin. In chronic rheumatism, weak, stiff, aching back, heat in the medulla and spine for a whole week, whole length of the backbone sore to touch, also ribs of left side, lumbago caused by straining or lifting, pain in the back of the hips, running around and down the limbs, pain in the sacrum and coccyx. Burning is very important character of medorinum. Burning of the feet has to fan them is a very keynote to medo. Along with forgetfulness, increased thirst, at least drinks 4 to 5 liters of water, recurrent history of UTI with much burning. Again, desires cloudy or rainy weather like causticum and carcinosin. Now, these are generally the medicines which we use to treat lumbar spondylosis. After this also, there are some rare medicines which we can think of in case of lumbar spondylosis. What are they? Let's see. Number 1 medicine in rare medicines is Gettysburg water. As I said in previous 2 videos, Gettysburg water is a great medicine for stiffness of the joints, both extremities and also vertebra. So it can be used as an intercurrent along with any constitutional medicines. The second medicine is Polygonum multifluoreton. You won't find this medicine in Metria Medica, and also you won't find this medicine in maximum companies. This is a very rare but excellent medicine for lumbar spondylosis, where there is extreme pain, where there is spondylolisthesis. Number 3 medicine in rare ones is cartilago. This medicine I have learned only a few months before than this video. Again, a very uncommon medicine we can give as an intercurrent to improve the health of the muscle fibers and ligaments. Number 4 medicine in rare one is valeriana. Now, valeriana has drawing pains in the loins and back, pain in the region of the loins as from a chill or a strain, lancinations in left lumbar region above hip, worse when standing and especially when sitting than when walking. Basically, these are few of the many medicines which we can think of in lumbar spondylosis. Now, I have mentioned all those medicines which I generally use in my practice to treat this lumbar spondylosis cases. So, with this thought, I hope that all of you have a great day, and wishing all my juniors, all my seniors, and especially my teachers, happy Doctor's Day. Thank you.